If you want to prepare for an interview for a local sports team, a high school football or a club team, and you're going to be a medical provider for them, and you want to partner with them, ultimately want to be able to help their community, and you want to know what is it that you need to prepare for to make yourself more attractive for an interview, to create that relationship, this video is perfect for you. So if you are trying to collaborate, partner, work with another organization that you maybe want to get observation hours, you want to get treatment hours, you want to be able to provide patient care for them, and ultimately you have a situation where you're working with a large group, an organization that has needs and wants, and you're trying to help them with their mission, right? Keep their athletes in the game, get them back to sport, whatever it may be. Then you have your goals, your wants. You want to get more observation hours, you want to get more experience, get hands-on experience. So you have two different people having different wants and needs. So how do you manage that? Ultimately, when you're interviewing with them, I think you have to acknowledge what their wants and needs are. Yours are very clear. What you have to understand is your goal is to help facilitate their mission. And the biggest challenge and problem that I see that healthcare providers do, whether you're a PT, an athletic trainer, a chiropractor, whatever it is, and you want to work with these athletes, you bring to the table, you bring to the interview what you can do for them. And that's not necessarily what they're thinking. Their mission is, I want the athlete to be safe. I want my athletes to be able to play all year long. Your goal is not to show your accolades. That's the first impression that people do. Don't talk about yourself. Don't talk about all your credentials and everything else. Ultimately, you got to figure out and ask and inquire, what's their mission? What are their frustrations? Where are they stuck? Where are they losing the most athletes? What is the problem that you can solve? So it's a lot of asking them, what are they looking for? What do they need? So you can put yourself in that position versus I'm a physical therapist, I'm a healthcare provider, and I have these credentials, and I've worked with a lot of athletes, and I can help your athletes. That is the worst case scenario. It's a very selfish approach. Whereas the organization's thinking, man, we are stuck, and we wish we had a healthcare provider here. The question you have to know is, which part are you stuck on? Is it that you don't have Friday night coverage? Is that you need help with Saturday morning injury checks? What is it that they need and want? Is it somebody that they need more people to refer to? Is it that they have a ton of injuries that are happening in season, soft tissue injuries? Figure out the frustrations. What is it that you guys are looking for? My goal here is to be able to help the community. That's your main focus. What is it that you want? Help the community, help athletes. You just want to give, not take. And that's where providers go wrong. I see a handful of physical therapists say, well, yeah, absolutely, I can bring them into the clinic. And what they get it. You're trying to get more athletes on your table, but it has to work two parts, and most importantly, for them. So what is it that you're doing for that organization? You're trying to be active in the community. What is it that they need? In order for you to figure out what it is that you can do for them, you got to figure out what is it that they need. So if you're interviewing with them, figure out their frustrations. Find 3 things that they need help with: Saturday morning coverage, Friday night coverage, and in-clinic support. Perfect. My name is so-and-so. I'm a physical therapist, or I'm a healthcare provider, and I can solve that problem. Here's the great part. I'm available Friday nights. I can support on Saturday, and I can see them in the clinic. What else? Where would you need me? Where can I help? And that way is a very selfless approach. And when you take that approach, that organization sees that you're a team player versus somebody who selfishly just wants to win and gain by having more athletes. So put yourself in their position. What is it that they want? What is it that they need? And how can you provide that solution for them? That's what you need to focus on these interviews. Every question that they ask you, well, where do you struggle with? What is your best trait? What is it that you want? It comes down to, I'm here to help you serve. My biggest challenge is that I literally have more time, I have more opportunity. I just want to give. And when you take that approach, it's very difficult for an organization to say, you know what, we're going to go with another applicant. The reality is you're the best team player. You're trying to solve problems, their solutions, not yours. And that's going to be your best approach to be able to successfully navigate interviews when you're trying to partner and work with other organizations inside your community, so you can work with more active individuals, get observation hours, just get your foot in the door with more athletes. That's going to be your best approach.